Well, 1 in 8 women will develop breast cancer in their lifetime. Have cases gone up or down over time?
Well, that's one of the big issues that, if anything, we have not decreased the incidence of breast cancer. So that's why it's so important. October, Breast Cancer Awareness Month, the important things that we want to send home. The biggest thing is early detection, because if you catch it early, like so many diseases, it is treatable. So,
Okay. So we're talking self-checks.
Self-checks. Make sure that you see your doctor at least yearly. At a certain age, you need to get your yearly mammograms. And if you're at higher risk because of genetics, family history, you have to be particularly vigilant and maybe do those things more often.
So breast cancer is actually more common for Black women under the age of 45. They're more at risk. Why is that?
Yeah, it's a genetic thing. And,
Okay.
you know, we don't know exactly why, but we're finding recently that with breast cancer, the genetics are so important. For example, if you have the BRCA gene mutation,
Okay.
or if your mother had breast cancer, then you know that you have
Okay.
twice the risk of developing it. So in terms of African Americans, we don't know exactly why. I mean, we know that other issues, hormonal issues and weight and other lifestyle issues do have
proper health care.
all of that does have an effect on breast.
Can you talk
health.
about, thank you, can you talk about just the advancements that were made? Breast cancer doesn't look the same way it did, let's say, 10 years ago. Advancements in technology and just research, it's not necessarily a death sentence.
Exactly. And as I said, the key thing is if you make that diagnosis early, there are great options to cure your disease and great options in terms of breast reconstruction. That's where I come in as the plastic and reconstructive surgeon for women. And I think that's another important point to make, because I think women are afraid. They may find something.
It's scary.
It's very scary. One of the biggest advancements now, new study came out, not all women diagnosed with breast cancer need to go through chemo. And for a lot of women, the chemo treatment is the worst part of the disease process in general. So that is a game changer. We found by genetic testing that not all women need the chemotherapy as part of their treatment.
Okay.
Wow, that's really cool. You can also use genetics to see kind of how the cancer will spread, right? So using all this technology.
The genetics will predict the course of the disease, and that dictates exactly how your doctor is going to treat you.
It's important you hear Dr. Ordon saying it doesn't mean what you think it means, and it's just always best to be proactive. That's what I hear you saying. Exactly.
Early detection, and make sure you see your doctor, self-examinations, and in general, as we say in the doctors, you know, just healthy lifestyle in general will keep your diseases at bay.
Okay, well, catch the doctors at 9 a.m. on our sister station, the U2.